Okay, good afternoon, everyone. As a preliminary matter, this is Stephen Vigent, Chair. Please permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Dr. George Abraham,
Present.
Jenny Fishman,
Present.
Kerry Stockwell, Principal Department Assistant,
Affirmative.
Karen Clark, Director of Public Health,
Present.
Dr. Michael Hirsch, Medical Director, City of Worcester,
Present.
Julie Van Arsdalen, Regional Environmental Health Coordinator,
Present.
Micah Blondeau, Regional Environmental Health Specialist.
Present.
Good afternoon. This open meeting of the Board of Health is being conducted remotely, consistent with Senate Bill 2475, signed into law by Governor Baker on June 16, 2021. This meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. The legislation allows public bodies to meet entirely remotely, so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. For this meeting, the Board of Health is convening by Google Meet, as posted on the town's website, identifying how the public may join. Please be sure to press *6 to mute your device, and this meeting will not feature public comment. Finally, each vote taken in this meeting will be conducted by roll call vote. Pursuant to Senate Bill 2475, signed into law by Governor Baker on June 16, 2021, suspending certain provisions of the Open Meeting Law, General Law, Chapter 30A, Section 18, this meeting of the Board of Health will be conducted via remote participation to the greatest extent possible. All meetings and hearings listed in the agenda will also be done through remote participation. Specific information and general guidelines for remote participation by members of the public and/or parties with a right and/or requirement to attend this meeting can be found on the town's website at www.shrewsburyma.gov/coronavirus. No in-person attendance or members of the public would be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time via technological means. In the event that we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive recording of proceedings as soon as possible after the meeting. To listen to the meeting, dial 1-617-675-4444 and enter the following PIN, 675-534-286-1895 #. Please mute your device. This meeting of the Board of Health is being held on Tuesday, February 15th, 2022 at 4:30 p.m. via remote participation, at which time and place the Board of Health will consider the following agenda. So I'd like to call the meeting to order. And the next item on the agenda is the review and approval of minutes from the January 14th, 2022 Board of Health meeting. Do I have a motion?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
myself, aye. The meeting minutes are approved. The next item is review and act on rescinding and making an effective date for the executive order to require face coverings in all indoor private common spaces in the workplace and indoor private spaces open to the public. And at this time, I would like to welcome Dr. Michael Hirsch for making a presentation and comments.
Thank you, Mr. Chairman. Is it okay if I share my screen?
Sure, go ahead.
All right. Are you so far seeing anything? Let's see.
No?
Anything yet?
No?
Nope. Okay. Uh, hmm.
It's working now.
Here we go.
Great.
Dr. Hirsch, we just see your desktop, not the presentation yet.
Working on it.
Got it.
Believe it or not, I did practice this, but
There we
here
go.
it is.
You
see
just
that
want to
now?
move it to slideshow mode.
It is in slideshow mode for me.
Okay. Dr. Hirsch, on the top of the screen where it says display settings above your slide, if you click on that and move it to swap presenter and slideshow view. And now we are in business.
Okay. Thank you, sir. Thank you, Dr. Abraham. So thank you very much for the board to give me the opportunity to explain why we have been, as a medical director and director, Karen Clark and I have been pitching the notion of changing our mask mandate proposals for the Central Mass Regional Public Health Alliance. So we submitted a similar proposal to the Worcester Board of Health. This is modified from that proposal, but effective February 18th, we would like to rescind the indoor mask mandate. That was issued in October of 2021 in the city of Worcester, and I think your board followed suit. This will allow institutions, corporations, businesses, and institutions of higher learning, also with a vaccination rate of greater than 90%, to start their mask mandate rescission immediately. The Mass Department of Elementary and Secondary Education, called DESE, has its own mask mandate, which has now been rescinded effective February 28th. And it could be up to your board to decide whether you want to abide by that or whether you want later acceptance of that. In the city of Worcester, the Board of Health agreed to a rescission of the mask mandate for private institutions and public meeting places. But for the school system issue, they wanted to wait until their next board meeting, which is March 7th. As far as diocesan, private, and charter schools, we're expecting that they will abide by the DESE guidelines, but that could be up to their internal school boards. As of today, the Mass Department of Public Health came out with very similar mask guidelines as we are proposing. So this was a nice encouragement. And the reason that we are making this recommendation, and I'll go through this quickly, I think instead of reading these things, I'm going to show you some very recent data. Here's the New York Times coronavirus tracker from yesterday, showing that the peak here, which was January 10th, has really gone away in the Omicron surge. We've seen a huge decrease in hospitalizations. This is for the county of Worcester. We have seen an increase in deaths steadily, but it has plateaued and has started to come down as of last week. And the test positivity rate, which had been hanging as high 3 weeks ago as over 20%, has now gone down to 7%. This is for this also Worcester County. This was a different platform that is provided by the Mass Department of Public Health, and their test positivity rate is also in the 7% range. For the city of Worcester, we were presenting the fact that the number of cases were really tumbling. We went from 135 cases per day on the day that the Worcester Board of Health voted in favor of the mask rescission. Now we are at 48.3 cases a day. And the hospital case numbers have decreased by 67% at St. Vincent's and 50% at UMass. If you look at the next slide, this is dated from yesterday, essentially saying that your test positivity rate in the town of Shrewsbury is even lower than that in the rest of the county, and in Worcester, it's at 7.18%. And another metric that we've been following very carefully has been the wastewater. This is the Blackstone Valley wastewater provided by the Biobot company. You can see the huge surge that we had in positive wastewater content of viral DNA, and it has steadily dropped until now. It's just about undetectable once again, as it was back in August. Um, Very encouraging. These are more specific numbers on case numbers in Shrewsbury, and you can see that you went from just in the body of the month of December, a test positivity rate of 6 up to as high as almost 21% as of the mid-January peak. And now you come down to 7% again. And you don't have the next week's number yet, but this is the most up-to-date number I could provide you with. Same with here, the 7-day average of cases has been coming way down. This is 7-day average, and this is 14-day average. So you can see if we went from 22 down to 13 and 16 down to 10, a steady plummeting. Just for your information, this is a map provided to us by the Prevention Research Center and Nikki Nixon, who is our epidemiologist, showing the lay of the land in terms of which parts of Shrewsbury have had the highest caseloads. It's fairly equally distributed, but interestingly, we got just yesterday a heat map for Shrewsbury showing the places where the most cases were reported. So this apparently is very close to White City, and this hotspot is very close to City Hall, Grafton and Maine. And as far as deaths go, uh, like we are seeing in all the other CRMPHA townships, the overwhelming number of deaths are in the 70 and up age range. They comprise almost 80% of the deaths, and the rest are in the lower age groups. And you can see the distribution is just about half of these cases happened in the hospital, less so in terms of the 80-year-olds. Many of them were in skilled nursing facilities or other places, but in the younger age groups, the hospital was where these folks expired. And this is just some of your latest vaccination rate, which is very encouraging. You, of the 5 municipalities in our CMRPHA townships, have the highest rate of vaccination, 79% fully vaccinated. Your booster rate is also higher than the rest, but not really where we would like it to be. Eligible people should be higher than 47% acceptance. So, and again, your positivity rate has come down to the 7% range. So why are we making this request? It's because of the multiple strains that play into public health, but don't strictly go by just number of cases and number of hospitalizations and number of ICU admissions and number of deaths. It is for the purpose of recognizing that businesses suffer when people go elsewhere to get their retail shopping, their entertainment, their dining, their activities of daily life, because the mask is oppressive to many people. We know from the mental health task force that Mayor Petty has been running that in the learning communities, both in the higher education communities and in the elementary and secondary schools, there are many, many students that have apparently lost their feeling of socialization, are feeling more isolated, and we've seen lots of untoward effects for that, including self-harm, violence, and inability to advance academically. So the business concerns are not obviously my concern. I'm not a business person, but I think that one of the things that I've learned about public health is you can't take the public out of the public health. And that's why I think when business owners tell us that they're facing bankruptcy, and then they would have employees that would be facing unemployment and financial insecurity, potentially eviction, and then self-harm themselves. Um, we really wanted to listen to this. So I know you guys have a time constraint, so I'm not gonna go through all of these. I think that certainly there are things that we need to do as the Department of Public Health to help monitor this very closely if you decide to go along with a rescission. We know that there can be new variants that come down the street. We know there's a BA2 Omicron variant that has made an appearance. There's also a Deltacron variant that has at least been seen in Europe. We will monitor this very carefully. These numbers that I presented to you, we check on almost every 2 days to see if there are new trends. And we certainly will have to see if there are trends after a mask rescission. We also want to emphasize that the rescission doesn't mean we don't want people to wear masks. People with immune compromise, people with other comorbidities, people over the age of 75, and anybody who feels more comfortable wearing a mask, we should allow for easy mask wearing without any compunction or feeling of being an outcast. We don't want people challenging people. Why are you wearing a mask? We want to be a mask-friendly community. And some people will choose to wear their mask indefinitely. I don't think anyone should throw away their mask, because I think that come the winter, we will definitely, in the winter of 2022 to 23, probably see a rise again in cases. I don't think the Delta or Omicron or whatever variant is around is going to completely die out. And you have on your board one of the true experts in this, Dr. Abraham, so I won't even presume to tell him what will happen, but I know that we're all going to be very vigilant moving forward. I think the key thing really is that we have to get needles in arms. We still don't have enough of our school-age children vaccinated. Of course, we don't have the 5-year and under vaccine approved yet, but when that happens, we need to see doctors' offices picking up the slack of doing the vaccination in their offices, and we have to make sure that people get their boosters. The breakthrough infections that we saw with Omicron, only 10% of those that were hospitalized had been boosterized. So the booster seems to be very protective of a lot of these new variants. And there's going to be new information coming down the pike about combination flu vaccine and Delta or COVID boosters. And there's going to be oral medication that people will be able to access more widely. So we'll have a lot more tools in the toolkit if these masks come off and we do see outbreaks. But I think that the time has come to kind of give people a dividend, and especially in your town where they've been so compliant with vaccination. I'm going to quit there and just thank you all for giving us the opportunity to present this information. And I know Kerry will make this slideshow available to all of you and to the public as well. Thank you very much for your time.
Thank you, Dr. Hirsch, for that's very informative presentation. Are there any questions for Dr. Hirsch?
Yes, I actually have one. Thank you, Dr. Hirsch. This was great for this presentation, pulling all this information together. I'm wondering if there's going to be any tracking of long hauler syndrome. We know that death is not the only negative outcome from COVID. And that is something that's impacting both people that had mild cases and more severe cases. So is there going to be any data around that? Because it's also impacting children as well as adults.
Yes, that's a great question. Yes, Karen Clark and I have discussed a number of different options that we might have. I know the state is going to be creating some kind of a database. There is a new long haul clinic at the Brigham, and there's
Yeah.
a 5-month waiting list to get seen there. So you're absolutely right. But this is something that we really need to track. And there are a number of options I think that we could work with UMass at the Prevention Research Center to see, which clinics are seeing these kind of patients. So thank you for bringing that up. I think it's a great point, and we will be tracking it in some way.
Great. I look forward to that. Thank you.
Okay, any other questions from the board?
No questions, Mr. Chair, but first I want to acknowledge the hard work of Dr. Hirsch and Ms. Clark in not only the daily surveillance, the gathering of this data and responding to all the queries and questions, but also in being here and presenting this information in a cogent fashion. Clearly, they do yeoman's work, which is often underappreciated, but we are extremely grateful for their vigilance and continued work. Number two, based on the data that's presented, Mr. Chair, I'd like to make a motion that at least for adults, we can definitely rescind the mask mandate as of the 18th, which would be concordant with what Worcester County has determined, or the Worcester Board of Health has determined, and I would be comfortable with that. Regarding the pediatric population in schools, the concern would be, as we have seen trends from our data across the last 2 years, that following every vacation week, there is a surge in cases, and as would be expected, we might anticipate some of that might happen. So I would consider or ask the board to consider the option of deferring a decision specifically on children in schools till a time definite, which would be, I'd propose March 4th as a potential date for our next board meeting, as well as to consider that specific question, by which time we should see some data on children after they have returned from their school break next week, and we should be able to be in a more comfortable position to determine when it would be safe to unmask for schools.
Okay, so it's the board is okay with an effective date of February 18th for the general public mask mandate rescission.
Yeah, I make the motion, Mr. Chair.
I will second that.
Okay, we have a motion and a second. All in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
myself, aye. So the motion to rescind the executive order for coverings in indoor common spaces for the general public is passed with an effective date of February 18th, this coming Friday. The next item on the agenda is review and act on rescinding and making an effective date for the executive order to require face coverings in all schools, public, private, parochial, and charter, K through 12.
Mr. Chair, I'd like to make a motion to defer a decision to March 4, 2022.
I will second that.
Okay, so the motion is to not to rescind at this point in time, but to revisit this item as of March 4th, after the school vacation.
That's correct. Motion, I'll make the motion.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
myself, aye. So the motion to defer that item is passed. And then the next item is review and discuss the executive order to require employers to report COVID-19 cases in the workplace. I believe, Karen Clark, if you're still on, that you had recommended maintaining this for the time being anyway.
Yes, that's correct.
Okay, any questions or comments from the board?
Is there a time period for which there would be this expectation to continue, or is it time indefinite or time definite?
Dr. Hirsch?
I would say that we're still going to be trying to look at trends once the masks come off. for at least another month. So if that would be okay, I mean, whenever your date, if your date is the 18th, I would say somewhere around the middle of March.
Okay. So, Mr. Chair, I'd be supportive of that just so that we can continue to monitor trends, including case rates, fatality rates, as well as hospitalization rates. And so that would help from that standpoint. So I'd be supportive of continuing that motion.
Okay, so I don't think we need to necessarily vote on this, but so maybe, I guess, if I could have a motion to maintain the executive order to require employees COVID-19 in the workplace until
So,
a
so move.
following meeting.
Yeah. So move.
I will second that.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
myself, aye. Okay. So the next item is to review the meeting schedule. And Dr. Abraham, you had just mentioned March 4th, which is an earlier date, mainly for the purpose of reviewing the mask
School.
for
Mandate in
schools.
schools. That's correct, Mr. Chair.
Is March 4th okay for you, Jenny?
Yes, that works. I'm available.
Okay. So we will plan on meeting again on March 4th to discuss the mask mandate for the schools.
Great. Thank you, Mr. Chair.
Okay. Okay, if there are no other questions or comments, do we have a motion to adjourn?
So moved.
I will second. And just thank you to everybody for your hard work.
Thank you, everyone. There's so much that's gone into this. It's amazing. Okay.
Thank
all
you
in-
for your support. I appreciate it.
Okay, all in favor signify by saying aye. Jenny Fishman,
Aye.
Dr. Abraham,
Aye.
myself, aye. The meeting is now adjourned. Thank you, everyone, for getting on today and providing us your very valuable input.
Thank you very
Thanks
much.
for having us.
Have a good evening.
Thank you, everybody.
Bye-bye.
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 Thank you.